Hi guys, this is Eva from Bay Harbor Med Spa, and this email comes from Abbas, and Abbas is asking me whether I have a treatment to get rid of holes from acne. So Abbas, shufti, here is the story. There is no treatment that can get rid of the holes completely. If you have holes that are not very deep, but they are superficial, they are just little bit deep on your skin, then my treatment and my products can help you to make it less visible so you don't see it as much and reduce it a little bit. But if the holes are very deep, I cannot help you. If they are very deep, you can use my treatment. It will make it better, but it will not get rid of it. Because when you have holes, when the holes are deep, it's like there is missing part of your cell. It's like there is missing, the holes is deep, that means there's missing cell, missing flesh. It was eaten up by the bacteria, so there is a big hole. So how can I do hocus pocus and get rid of the hole? No. If the hole is very, very deep, they are very, very deep, don't bother to buy my products because it will not help you. But if the holes are medium, not that deep, or they are superficial and you want to improve it, I can't make your skin smooth like mine, not possible. But if you want to improve it, and if you want to have improvement between 30% to 60%, if that is good enough for you, then what I would suggest for you, Abbas, is that you get this mandelic acid stage 1 line. You buy yourself the microdermabrasion scrub, and you buy yourself the microneedle roller that you roll on the scars. These three things will help you to reduce the visibility of the scars. But it will not take it completely away. It will improve it. It will get better. How long do you have to do it? Well, it depends how many scars, how deep the scars are, but you might do it half a year, you might do it for 8 months, you might do it for 3 months. I don't know because I don't see you. But as a general rule, if you have holes in your skin from acne and they are medium deep or lightly, just a little bit deep, then this is what you should do: the mandelic acid, the microdermabrasion scrub, and the microneedle roller. These are the three components. Why do you need to use these things? I'll tell you why. The microdermabrasion you would use on the scars 2 to 3 times per week. You would abrade the skin, so you would remove all the oil, all the sebum, all the deposits that's in the pores, and it will remove the top layer of the skin. Then you will take this microneedle roller, the microneedle roller, and you will go with the microneedle roller up and down in every possible direction. You will go with the microneedle roller, particularly on the areas where you have holes, where you have indentations. Now, when you do it only for a few seconds after you did the microdermabrasion on the scars, on the holes that you have. You make it red, but you don't make it bleed. You don't make it bleed because then you're not achieving it. You just make it red. And then the next day, you use the mandelic acid, this. But before you use the mandelic acid, you have to wash the face and prepare the face for mandelic acid. So you would wash it with the cleanser, wash it off. Then you would take the toner on a piece of cotton. You put the toner on a piece of cotton and you would wipe the face. Wherever you have holes, you would prepare it. That means the skin needs to be totally, totally clean. There should be no residue, no oil, nothing on the skin. And then you would apply the mandelic acid. You would take a little bit, it comes as instructions, and you would put it on the scars where you have indentations. You would leave it on the skin for 3 minutes. Then you would take it off with the neutralizer, and you will repeat this treatment twice a week. So the day that you will do 1 day microdermabrasion and microneedling, you will do the next day the mandelic acid treatments. That's what you should do, and you will repeat this treatment. You can do it once, twice per week. It's up to you. It's a slow and gradual process. What we are doing is, when we are braiding and then using the microneedling roller, we are creating microchannels. We are stimulating blood circulation. We are stimulating collagen that is in your system. I don't give it to you, you have it. So that there's more circulation that comes to the skin. It brings more nutrients and it brings more collagen to the skin. So we want this. So we irritate the skin to bring more collagen, which will help for the scarring. And then the next day, when we use the mandelic acid, we are peeling the skin, removing the top layers, removing some of the discoloration, and again stimulating new regrowth of cells. But I cannot tell you if you should use it twice a week or once a week. Perhaps you start with once a week and then you see how that works, and then you go to twice a week. And you have to use the mandelic acid moisturizer on your skin, and you have to progressively, slowly give yourself time. As I said, for some people it's 3 months that they will see an improvement. For some people it's 5 months. For some people it's 8 months. There's not two people alike. But that's only in the case that the holes are not too deep. If they are medium deep and light deep, okay. If they are too deep, then we cannot do anything. That's too late. Okay, so I hope that I answered your question, and until next time, thank you, Abbas. Bye bye.